I actually think that AHA has not issued a formal document like we do for things like blood pressure and cholesterol, where they outline all the specifics. But AHA has, since the beginning of the pandemic, strongly endorsed the recommendations by the CDC and other public health agencies. And now that we have vaccinations against COVID, strongly endorses that all high-risk patients, especially those with pre-existing heart disease, prior stroke, get the vaccine. I think the majority of us physicians who participate with the AHA are also in agreement with this recommendation. AHA's been publishing a lot of science and has done a number of studies that have shown that people with prior heart disease are at increased risk of severe complications from COVID-19. And so absolutely recommend the COVID vaccine for anybody who's at high risk as soon as it's available to your particular group. And important to know that most public health officials are saying that get whichever vaccine you can as soon as you can. There's a little bit of questions because one of the vaccines in the clinical trial the Pfizer and Moderna vaccines appeared to have higher efficacy than the Johnson & Johnson vaccine. But the bottom line number that we care about the most is how well these vaccines prevented people from getting hospitalized from COVID and how much they prevented people from dying of COVID. And even the Johnson & Johnson vaccine, which the top number wasn't quite as good as the Pfizer and Moderna vaccine, 100% effective against hospitalization and death from COVID-19. So this is an embarrassment of riches as far as a vaccine person is concerned. We have 3 vaccines that are almost 100% effective at keeping you out of the hospital from COVID-19. So as soon as you're eligible, especially if you're in one of those high-risk groups like people with heart disease or prior stroke or older adults, get those vaccines, protect yourself and protect other people that you interact with.